I'm Dr. William McClellan. I'm an orthopedic surgeon practicing in Cincinnati in the northern Kentucky area. My primary focus is neck and back, and I specialize in spinal surgery. Today I want to talk about a commonly overlooked cause of low back pain, the sacroiliac or SI joint. The sacroiliac joint is a large joint in the pelvis that links the sacrum to the iliac bones. The SI joint is supported by large ligaments and muscles, and in a normal SI joint there is very little motion because of these stout supporting structures. Like any other joint in the body, the SI joint can degenerate and become painful, or its supporting ligaments may be injured. Common complaints we hear of those suffering from SI joint pain include low back pain, leg numbness, tingling, weakness, pelvic and buttock pain, hip and groin pain, feeling of leg instability, pain with sitting, and difficulty sleeping. The study suggests that 15 to 50% of chronic low back pain may be coming from the SI joint. Other studies suggest that up to 40% of symptomatic post-lumbar fusion patients may be having pain coming from their SI joint, which means if you've had a previous spinal fusion in your low back, you may be at higher risk. A thorough workup must be performed to isolate the SI joint as the source of pain. This is accomplished by listening to the patient's symptoms, a physical exam to test the SI joint, the spine, and the hips, and injections into the SI joint. There are non-surgical treatment options for SI joint pain, which include medications, physical therapy, SI joint injections, and radiofrequency ablation. And then for patients who have continued debilitating pain after these treatments, a minimally invasive SI joint fusion surgery may be an option. At OrthoSensei, we use the iFuse implant system. The iFuse has a unique patented triangular shape to provide immediate stabilization and long-term fusion of the joint. The entire procedure is performed through a small incision in the side of your buttock and typically takes less than an hour to perform. There are more than 70 peer-reviewed articles that demonstrate the safety and effectiveness of the iFuse implant. The iFuse is actually the only SI joint fusion system with studies that show it improves patient function, quality of life, and pain. In a randomized control trial, 90% of patients were satisfied with the results and would have the procedure done again. SI joint dysfunction is a very common cause of low back pain, and it's often overlooked by many physicians. If you're interested in hearing more about the sacroiliac joint disorders, or to see if you're a candidate for SI joint fusion surgery, please contact us at orthosensei.com or call 859-301-BONE.